I am a person, I'm never ever satisfied. I can't say, well, oh, I'm happy to go. I still, follow things as they go along. I'm still, engaged in what it is. I participate a lot in some, now that we have all the virtual meetings and so on, give my inputs. And my directors who have come to really trust and work closely with, we still bounce things off, and they share ideas and things like that. I work very closely with all of the 7 programs at the ministry. I think the relationship still continues. Of course, I stand ready, if that is the case, to give whatever service I can.
What is next for you?
I need to get a few things in terms of personal life organized. Focus a little bit on family and some personal issue, but I still want to, give whatever service I can, even if it means a bit of practice too. I'm toying with that idea also. Maybe get back into, some patient care and see how that works. I think service was really just the thing that really was important to me. I don't know if there is a trumpet I can blow.
Or you don't want to blow your own trumpet?
Well, it's left up for that. A lot of persons, on hearing of my retirement, I've had a lot of people coming out to say, oh, you're a caring doctor, you've been a good doctor. For those who I've seen as patients, of course, for the last 13 years or so, I was not in active practice. So people are referring to that period prior to then. If filaria is still a pretty much neglected disease, but that one still stands out as one of my favorite. Going around when I started that program, I recall visiting with persons in the various regions and going to their homes, people who were afraid to even come to health facilities. And, you see the suffering and the embarrassment, the shame sometimes that some people have. They didn't even want to lift up their skirts or raise their trousers for you to see their leg. And, it was smelly and they had all these lesions. So those kinds of things was really hard to really come to grips with, to see how people suffer silently for simple things that you could actually do something about. So those were, I think, my best moments. Reasonable, I would say. You might have to ask the ministers I served with. I think it's about 9 in all. From I think way back to Mr. Hamilton Green probably was my first minister when I was just starting in the career of being a doctor, and moving through Minister Teixeira, Minister Henry Jeffrey,
Without getting into any specific, could you recall any sort of conflict or pushback between your political bosses and what you knew as a doctor?
Well, at times, there were different focuses, and as CMO, you always had to bring a balance. What I strive to do always was to try to provide, as far as possible, the most accurate and reliable information to all ministers, whoever I worked with. Sometimes it was accepted, sometimes it wasn't. I recall, when we had a spat of very high levels of maternal deaths, somewhere about 2012 or thereabout, it was intense pressure. It was difficult economic times. I had family, children were ready for school and so on. So I did practice intermittently, but I never left the service. I always seek and obtain permission. Held a little clinic, but I always steadfastly, give my service to the nation. It was tough, and I have 3 children now, and 2 older ones. My daughter actually just finished physical medicine, physiotherapy, and she's back with Georgetown Hospital actually working in the COVID unit. My second is a boy, and he has completed his, or part of his pilot program. He's still trying to get himself in order, and I have a younger one. Unfortunately, I'm divorced, but nevertheless, we continue to, care for our children, and two of them still live with me, actually.